After a long day, many people just want some peace and quiet. But some medical conditions make that almost impossible. Tinnitus, or tinnitus as it's sometimes called, is a hearing condition that can be frustrating or even debilitating.
Tinnitus is derived from a Latin word. It's actually a verb and it means to ring. And what most people identify as tinnitus is a head noise in the absence of any external sound. We have patients come in who will describe it as ringing, roaring. It can be bilateral, meaning in both ears. It can be unilateral, meaning in one ear.
Dr. Sharon Blackburn is a hearing specialist with Audiological Services of Cadillac. She says that while tinnitus isn't widespread, it definitely is not uncommon.
10 to 15% of the population suffer from chronic tinnitus to the point where it can be debilitating, and 80 to 90% of the population who have tinnitus also have an associated hearing loss.
Ringing in the ears can affect a wide range of the population, and there are a variety of causes of tinnitus. However, some people are at more risk than others.
For those individuals who work around excessive noise, they should be wearing ear protection because noise-induced hearing loss is probably one of the primary contributors to tinnitus. Individuals who have certain medical problems, high blood pressure, arthritis, any thyroid or heart issues, their medications can also create the tinnitus symptom as well. If there's an individual who has been in a car accident or fallen and hit their head or had concussion, those are also causes for tinnitus.
Some people are able to simply ignore their mild tinnitus, but people who are affected more dramatically by the condition can seek specialized medical care.
One of the ways to do that is through the hearing test. Again, I said 80 to 90% of people who have tinnitus also have a hearing loss. The causes of hearing loss with tinnitus patients can be noise-induced hearing loss. So we want to prevent further damage because of repeated noise exposure. We will look at them medically to see if they have had serious health problems.
Advances in hearing technology mean that many cases of tinnitus are treatable, and solutions ranging from sound machines to special hearing aids can make a big difference.
When a person has tinnitus, it's a constant ringing or a constant sound in their ear in the absence of any external sound that could be triggering it. If the person has a hearing loss, and even without a hearing loss, a hearing aid and or a masking device would be programmed and fit to that individual, verified to be sure that it's programmed appropriately, and the patient not only may notice that their hearing and speech clarity is improved, but one of the side effects is that the tinnitus is diminished.
For My News 26, I'm Kayla Kiley.